I think this is an interesting question, because obviously if anybody has the symptoms that I'm describing, or even a suggestion that they may have carpal tunnel syndrome in terms of the symptoms that they've been having, they want to know, what's the likelihood that I've got it? You know, should I be going to my doctor? And in terms of the tests that you can do, it's actually a difficult question, because even when somebody comes to me with carpal tunnel syndrome, there's a limited number of tests that I can do that tell me one way or another, and then even then they're not 100% sensitive in terms of telling me that the patient has or hasn't got carpal tunnel syndrome. In many ways, the most important thing to be aware of, and the most important thing in terms of considering whether you've got carpal tunnel syndrome, is being aware of the symptoms. So understanding what carpal tunnel syndrome gives you in terms of the symptoms that you get with it, being aware perhaps that the sensation problems that you've got in your hand are more on the thumb side than they are on the little finger side. These little things that may veer you towards thinking that actually it may be that I've got carpal tunnel syndrome. I think it's first of all being aware of your symptoms, also being aware that if you're waking up at night on a regular basis, and if you're waking up at night with pain and with these altered sensation in your hand, that's a very typical symptom of carpal tunnel syndrome, and that's a very typical symptom of carpal tunnel syndrome in its early stages. So I think that is a very good marker of when you should be seeking advice in terms of, should I have something done about this? Because it can be incredibly obtrusive, and if it's persisting for several weeks, then I would suggest that you should seek advice, because it's a very typical symptom of carpal tunnel syndrome. Also, if you're getting pins and needles and tingling during the day, particularly if you're on the phone, anything that's holding your hand up, reading a book, reading a newspaper, driving, there are things to be aware of. So these are not tests, but they're if you're aware of the fact that those are associated with carpal tunnel syndrome, then it makes you more likely to seek advice and to seek medical advice. And I think it's important to seek medical advice in those cases, because you don't want it to progress to the point where any treatment is less likely to be effective. So if you've had the pins and needles and you're starting to get numbness, it's a sign that more problems could be occurring, and try not to get it to that point. In terms of tests, though, I think you can reliably do some of the tests that a doctor will do if they see you. You can tap over the nerve at the wrist, and if that produces a shocking sensation into your hand, potentially it's more likely that you've got carpal tunnel syndrome. If you pop your elbows on a table and you hold your wrists down as bent down as you can, and you start to get the same pins and needles and tingling on the side that you commonly get the carpal tunnel syndrome, that may well be a sign that is what you've got. Some people, of course, get carpal tunnel syndrome on both sides, and you may get don't be put off if you get the symptoms on both sides, because you may just have carpal tunnel syndrome on both sides. But I think it's that the most important thing is being aware of the symptoms, being aware of the fact that may be what you've got. And also, if you've got the symptoms at night, the fact that it may be improving when you use a night splint, that is a good sign that you've got carpal tunnel. That may be all that you need. But if your symptoms are improving when you're using a night splint, but they're persisting to some extent, I think that's a fairly good sign that that's what you've got. But I think it's just being aware, and also being aware that provocative things can cause your symptoms to be worse. And if those provocative things are related with pressure on your nerve, then it may well be that you've got carpal tunnel syndrome. In terms of managing your symptoms, one very easy, straightforward thing to talk about is night pain. Night pain can often be helped by wearing a splint with the wrist in a straight position. That's the position that we know it applies least pressure on the nerve. So it's a good thing to try if you're getting night pain as a predominant symptom of carpal tunnel syndrome. It may not work, but you may find that it makes it better. Some people don't tolerate splints, but I think it's definitely worth trying, because that's a definite relatively straightforward thing that you can do to control your symptoms. In terms of other do's, I think try and avoid activities that you know fairly repeat, that you know are more likely to bring on your symptoms. So if you are in a work environment where particular positions of the wrist or particular things that you do at work are more likely to bring it on, then try and avoid those things if possible. Try and alter your work environment so the position of your wrist is less likely to put pressure on the nerve. So those are definite do's. And in terms of don'ts, I think it's the opposite. Try and avoid activities that make it worse. But definitely another don't is if your symptoms are progressive. If you've had night pain and if you had pins and needles and now you're starting to get more problems with sensation, more numbness, those symptoms are there more regularly than they were, then don't leave it too long, because if you leave it too long, there will be damage to the nerve and there's nothing that any treatment can do to reverse that. So it's really important to not let your symptoms progress to the point where there is irreversible nerve damage. So that's really my biggest don't, is don't live with your symptoms to the point that you've left it for too long and the treatments are no longer able to reverse those symptoms, because some people will be left with permanent numbness if their treatments are not instituted early enough, and that's really quite a disabling thing in terms of being able to use your hand normally. There's two sides to this question, and there's the scientific side. The scientific side is probably very little evidence for any of those. But I always find it fascinating that when patients come to me and they tell me that they have night pain at night, or when they have pain at night, I always ask them what do they do about it? Because classically, patients will tell you they have to get up, they have to shake their hands, they have to move about, perhaps increase the circulation, perhaps redistribute the fluids in their body. But some people will tell you that their symptoms will get better if they put their hand in the fridge. Some people will tell you their symptoms will get better if they run the hand under hot water. So there are some things that for some people will help. And that's a trial and error thing. And that just reflects the fact that this is such an intrusive condition at night that people will have tried everything to make it better. And some people find that cold water helps. Some people find that hot water helps. Some people find that going out for a walk with the dog in the middle of the night helps. But, you know, there is usually something that they can do to make it better. So on the one side, science won't really back up any of those. But for individuals, yes, I think that some of those things definitely help. Well, again, there's not a great deal of evidence for that. I think that there are so many different supplements out there that I think you'll find probably that somebody will be recommending every single one of them for carpal tunnel syndrome. But in terms of evidence, there's not much evidence for it. There's no doubt that it's important to have a good balanced diet. It's important to have the right nutrients, and it's important to have the right constituents in your body to deal with that one of your nerves has got pressure on it. You want that nerve to be able to function as well as possible and to try and repair itself as well as possible when that pressure is taken off it. So in terms of vitamin supplements, not a great deal of evidence, but I think it's important that you have the right vitamins in your body and if you in your diet. And if you don't, then yes, take supplements, but not just for your carpal tunnel, but for your overall health. There's also a certain amount of evidence that some foods, perhaps berries, perhaps leafy vegetables, have a slightly greater anti-inflammatory property than others. And I think there is a component of tunnel syndrome, so it might be that they help in your diet, but again, not a great deal of evidence. Much more important is making sure that you have a balanced diet and you're getting all the nutrients that you require from your normal diet. In terms of the treatments, the simplest treatment for carpal tunnel syndrome is for those people that tend to get symptoms mainly at night. It's a very, very common, very typical symptom of carpal tunnel syndrome, that it will wake you up at night with pain and tingling, or pins and needles in your hand. And that is bad enough that it will not only wake you up, but it will make you feel that you have to do something about it. And patients often feel that they have to shake their hands, they have to hang their hands over the side of the bed. Some feel that they have to get up, some feel that they have to run their hand under hot water, cold water. It's different for different people in terms of the things that they will have to do to make it better, to be able to get back to sleep. But it's really an awful thing if that's happening to you every night. A very simple thing that can be tried for those patients is to use a splint at night, to hold the wrist in a straight position that applies the least amount of pressure to the nerve. And for many people, the use of a splint at night is all that they need. They no longer have the obtrusive night pain, and they no longer have the other symptoms of carpal tunnel syndrome. And that is in many ways a curative thing for some people, not for everybody. In those people that have tried a night splint and it hasn't helped, or has helped, but they still perhaps get symptoms during the day, or where they haven't been able to tolerate a wrist splint, then we have to think about other treatments. For those people that they reliably know that they're going to get their symptoms with certain activities, then there may be a possibility to modify those activities, particularly if they're work related, or related to the way that you use your hand, or you position your hand when you're at work. So there's definitely a role for ergonomics and activity modification, perhaps taking more frequent breaks from the activities that cause you to get carpal tunnel syndrome. So again, a relatively simple measure that may or may not be possible and may or may not make a difference. People generally come to me when they've tried those measures. They've tried a night splint, maybe that's helped, but they're still getting symptoms, or maybe there's only so much they can do at work, or maybe when there's no activities that they can pinpoint that they can change. And then in the cases where we've made the diagnosis, where we know it's carpal tunnel syndrome, or even potentially in the cases where we want to be sure that it's carpal tunnel syndrome and we don't think it's a very severe form, then we have the possibility of trying an injection. An injection into the carpal tunnel, which can be carried out into clinic, and it's a relatively pain-free procedure. The principle of that is you're introducing a substance into the carpal tunnel syndrome, which is a strong anti-inflammatory. It's a steroid. It reduces swelling, and it therefore reduces pressure on the nerve. And that you can see that logically you can understand how that works. And that has a very good chance of improving the symptoms that you have related to carpal tunnel syndrome. Now, it may be that it cures your carpal tunnel syndrome. Those symptoms may not come back. And in many cases, we do find that that's what happens. But it is by no means guaranteed that when you have carpal tunnel syndrome, you will need to go on and have an operation, because for many, many patients, the carpal tunnel injection is all that they need. In some cases, in some patients, they will get their symptoms back after a carpal tunnel injection. Now, if the carpal tunnel injection has helped for several months, there's no reason why you couldn't consider it again. And in many cases, doing it a second time will actually settle it down. If the carpal tunnel injection has only helped for a short period of time, then it's probably not worth trying again, and we need to think about the other step. But for many patients, that's all you need, maybe one, maybe two. If a patient haven't helped for very long, or they've had repeated injections and we're not really getting anywhere with that, then we talk about surgery. We also talk about surgery in the cases where the patient presents with the suggestion that nerve is starting to be damaged, and there is a potential that if you don't take that pressure off, then that nerve will not recover. I tend to veer more towards surgery in those cases than injection, because we don't really want to lose any time in those cases. So in those groups of patients where we're considering surgery, that is the last step in terms of the treatment ladder, and it's a very reliable way of taking the pressure off the nerve, but obviously it does involve an operation and the recovery time and everything related to it. But it's a relatively simple procedure that gets carried out under local anesthetic. When I say relatively simple, it's relatively quick. That doesn't mean to say it's not an intricate procedure, because it's very important to make sure that it's done properly. But for the patient, it's a relatively simple and straightforward procedure when compared to many other procedures that we might be talking about.